Hey guys, Dr. Ben here, Functional Medicine Centers and F8 Well Centers. Excited to have everyone on our video today. We're talking about type 1 diabetes, and this is prevalent so many places in the country, in the world now. For me, when I was growing up, the only place I'd heard of type 1 diabetes was with little kids. They developed type 1 diabetes, and then they would have to be on insulin, all that. Today's day and age, we see it way more in adults getting type 1 diabetes than kids. And why is that? Well, type 1 diabetes is an autoimmune condition, just like Hashimoto's, just like rheumatoid arthritis, just like MS, lupus, alopecia, ulcerative colitis, all these different autoimmune conditions. Type 1 is just one more in the book. And so what happens is the body goes haywire. It starts attacking its own pancreas, destroys the cells that secrete insulin, and then somebody has to go on insulin. We hear this all the time because I say we can reverse type 2 diabetes in 6 to 8 weeks. The body can do that. It can repair, it can rebuild. Type 2 is going to be food induced. It's going to be sugar. It's going to be that glucose spiking up, damaging the tissues, not able to stabilize everything. But what we look at with type 1 diabetes is it's autoimmune. So yes, we can reverse these. Hey Chad, good to see you. We can reverse this type 2 diabetes, but type 1 diabetes, most people just throw their hands up and go, take insulin like you need to, dose yourself accordingly. It's gonna go high, it's gonna go low, and you just gotta eat some sugar when it goes down low. You gotta take more insulin when it goes up. Well, get this, we've got 3 patients currently that have type 1 diabetes, all in their 40s, and guess what? They are more stabilized than ever. One lady I was just talking to on Monday, she's 90% of the time she's in between 80 and 120. She's never had this. She's had type 1 diabetes for many years now. She's never had this much stability. She's going to talk to her doctor about decreasing her insulin. Another patient, he's talking to his doctor about decreasing insulin. You know, they've just been told, hey, just eat whatever you want and then dose yourself accordingly. But what happens is this is very, very stressful to the body. People will be hitting 200s, 300s, 400s, swinging up, crashing down because they take too much insulin. But guess what? If you do what you need to do and stabilize this blood sugar, I don't care if you're type 1 diabetic, type 2 diabetic, type 3 diabetes, which is what they're called Alzheimer's now, insulin resistant, blood sugar swings, highs, lows, anything. If you do our program and work on that glucose monitoring like we do with patients all the time, your blood sugar can become very steady. So Chad, great question there. I wake up with blood sugar 118 to 120. The range that you want to wake up for your glucose levels is in 85 to 99 is where you want that glucose. If it's too high, multiple reasons for that, you're probably going too high throughout the day. So we want blood sugar anytime we test throughout the day, 85 to 110. If it's fasting first thing in the morning, it's 85 to 99. Hey Abe, good to see you in St. Louis there. And so we know that that is the good range that we want it to be in. If that range, if we're going too high or too low, it's going to stress out the body and it's going to throw a lot of different issues in there. Good to see you. So the one we use in office is the Dexcom 6. And that's what we use with our patients. So every new patient that we get, we start using that continuous glucose monitor for years. We've used the finger prick and gotten great results, help patients reverse their diabetes, all types of different things. One of the type 1 diabetics, they were at 7.6 when we started, maybe 2 months ago, and now they're down at 6.3, the lowest their A1C has been since they've been diagnosed type 1 diabetic. Remember, type 1 diabetes is an autoimmune condition. So for most people that have one autoimmune condition, they have multiple. So if somebody has Hashimoto's, they usually have an ANA or a lupus marker. If somebody has type 1, they usually have another marker. And so for the vast majority of people, all they do is just go on insulin, but they don't fix the why. Just like if somebody has Hashimoto's, autoimmune thyroid, they go on thyroid medication, and then guess what? they don't do anything else. They don't change anything else. But you've got to stop that autoimmune reaction that's going on in the body. So great news. Even type 1 diabetes can be stabilized dramatically. They can stay 90% of the time in that 80 to 120, even on insulin, even on medications. They can do this. You can do this. If you know somebody with autoimmune condition, have them watch this video. If you know somebody with type 1 diabetes, encourage them to watch this as well. Do you recommend continuous glucose monitoring for those who don't have diabetes? Share, every new patient that we start with uses a glucose monitor. That's it. We don't do anything else there. How long after eating should I test? If you have a continuous glucose monitor, it's great because you can see it every 5 minutes. We get feedback. But for most people, somewhere between 30 to 60 minutes is going to catch that peak. Some people peak even earlier, is what we're finding with the CGMs, but you want to catch that peak somewhere in that 30 to 60 minute range. And you'll be amazed. Some people are hitting 130s, 50s, 80s, 100, 190, 200 even. It's amazing how these numbers go up. But then a lot of people will crash down afterwards. So like hour and a half, 2 hours after, you want to test again because that is when that drop is coming. If we had everybody do this in the entire country, 90% of chronic conditions would reverse or they would be prevented. It's that much of an issue. It's why I wrote my blood sugar book and why we're so intent on getting people stabilized there. So thanks for jumping on, everybody. Even type 1 diabetes, people can stabilize that blood sugar. And if you know anybody dealing with these issues, have them watch this video, share it with them. We have 3 patients currently that we're working with that are so much more stabilized. They're so less stressed out on their system, less insulin, less inflammation going in their body. So anything you look at, there's a chance to heal. We are fated to be healthy. We are fated to be vibrant and have this life that we ultimately want. So keep up the great work, guys. Stay strong out there, and we'll talk soon. Bye-bye.